Hi, I'm facial plastic surgeon Dr. Jason Champagne, and today I'm going to be talking about hairline lowering. Now, this procedure is also known as forehead reduction or hairline advancement, and it's a very popular procedure in my practice. The average patient who comes to me for hairline lowering is typically in their 20s or 30s, female, and they have a very high hairline or large forehead. Now, as you can see in this photo here of one of my patients, I've marked out in 1 centimeter increments on her forehead. Starting at the mid-brow region, the average hairline is usually around 5 to 6.5 centimeters above the mid-brow. But as you can see in her photo, she's much higher than that, well above 9 centimeters. So this patient came to me considering hairline advancement, and we discussed her options. And one of the most important factors of this procedure is to have a loose or laxity to the scalp. And there's a simple pinch test that can be performed. And it's similar to just taking your hands and pinching your skin. And if you can get approximately 1 centimeter of skin between your fingers, then that's usually approximately 2 to 2.5 centimeters of skin that can be removed to advance the hairline. Now, one of the biggest questions about this procedure is the method in which the hairline is advanced. And what the procedure requires is an incision at the hairline. And a lot of patients are concerned about that, so I want to talk about the hairline incision just a little in a little more detail. Now, this is one of my own publications, and I should mention that I have written and published textbook chapters and journal articles on this subject. And this is one of my own illustrations that's been published with one of those chapters, and it shows the incision line at the hairline. And the incision is made in such a way that I bevel across the first 2 to 3 rows of hairs, approximately 90 degrees to the natural exit of the hair. And what that allows the incision or the hairs to do is to grow through the incision line, which will eventually completely camouflage the incision within weeks to months after the procedure. And that way there is no visible incision line over time. Now, this procedure is a very effective and efficient method of moving the hairline forward. And as you can see, this is one of my patients pre-operatively, and this is the very day after the surgery with sutures in place right at the hairline and a little bit of ointment. But you can see that even the day following, there's very little change to the surrounding structures, but you can notice significantly that the hairline has been lowered. There's very minimal swelling, no bruising that you can see, and she reported no pain, which is very common. And this is a side view. Now, for this patient, she had very loose scalp, and I was actually able to move her hairline down approximately 3 centimeters. And her hairline was moved to just where the scalp or the skull turns backward over the top of the head. And that's where an average hairline should be. Overall, the recovery is very minimal, with minimal swelling, and that's the most likely post-operative result. And other than that, a little bruising is possible around the eyes, but it's extremely rare unless a brow lift is performed with the procedure. So I'd like to thank you for listening today, and if there are any further questions about the procedure, I'd be happy to talk with you either through email at drchampagne@champagnecenter.com or give us a call at the number below. Thank you.